Hi, Dr. Larry Altshuler here, talking to you about healthcare and healthcare reform. Telling you things that you won't hear from the media and you certainly won't hear from the politicians. Now, in my previous video, I told you about 3 provisions in the Affordable Care Act that attempt to decrease healthcare costs, because in other videos I've told you how much the Affordable Care Act is really going to cost us. Too much to even estimate at this time. But there's another provision in the Affordable Care Act that is also aiming to decrease health care costs, and is one of their biggest provisions. And just like the other provisions, however, it's going to fail miserably. And let me tell you why. And what is this provision? This provision basically states it is to develop and evaluate pilot programs for old and new payment ideas. In other words, what they're trying to do is find other payment systems besides the fee-for-service system to see if that will decrease medical care costs. Well, let me tell you some of the problems with this. Number one, they're looking for pilot programs. They're not actually doing the programs. But let me tell you something. These pilot programs have already been tried and already failed. There's been lots of them. Capitation, bundling payments, value-based systems, rewarding quality, care coordination, chronic disease management. All of these have already been tried, and yet the Affordable Care Act is going back and visiting all of them. The Congressional Budget Office just came out with a study. 20 years of trying these pilot programs, every one of them failed to decrease medical care costs. And yet here we go again. Affordable Care Act, bring them on, just wasting that money. Now, there are 2 programs one that may be helpful, but one that's not going to help at all. But that the Affordable Care Act is really pushing hard. What that is accountable care organizations. They're called ACOs. Now, you're saying, okay, accountable care, that sounds good, but in actuality, that's still an old program. They've just modified it a little bit. ACOs are almost exactly like HMOs, health maintenance organizations. As we well know, the vast majority of HMOs failed. ACOs are going to fail also for the same reason. But ACOs are a little bit different, which is even worse. Because with HMOs, what happened, the whole system is to get a group of doctors and hospitals together to try to get more efficient care and eliminate the waste, to lower healthcare costs and increase quality, and do that just by being more efficient and appropriate. That's the basic idea. Well, HMOs weren't able to do that because to decrease costs, they had to restrict and ration care. Same thing's going to happen with the ACO. But this time, the government's having a different approach. Instead of capitating, which means that the government or companies pay a certain amount for each patient, what they're going to do is they'll say, okay, we have all these measures that we want you to measure, and if you fulfill all those measures, then we're going to give you a bonus. But on the other hand, if you don't meet those measures, we're going to punish you. We're going to make you pay penalties. This is very, very different. And any system that has penalties doesn't work out, because what happens is this ACO will do everything they can to decrease costs, but won't think about the services they're given, and will ration and restrict services again so that they don't get penalized. That's what's going to happen with the ACO. And these measures, by the way, are the same measures that the government has used in past pilot programs. And they have failed miserably because the measures are not the ones that really show good outcome, that improve medical care. And because of that, all of them have failed, and the ACO is going to fail as well. Now, that's not the worst problem, because the Congressional Budget Office has said the ACOs, if they work correctly, will save some money. How much money? $1 billion over 3 years. Now let me put this in perspective. That's $333 million a year. Our total healthcare cost approaches $3 trillion a year. That's 0.01% of our total healthcare expenditures per year. That's not going to make even a tiny dent into our healthcare cost. Yet this is what the government is pushing, these ACOs. Again, what you're going to find is that they're going to restrict services, ration care. It's still a fee-for-service system. It's still specialty-based. And as I've told you before, those two things work against you. They cause a lot of waste and cost a lot of money. Again, ACOs are not going to work. They're going to find the same area that HMOs found, and they're going to fail. Now, I will tell you that there's one pilot program that the government's looking at that probably would succeed. It's called the medical home, and it's a primary care-based system, and there's been pilots out that have actually shown success at decreasing costs and increasing quality care. The problem is the Affordable Care Act is not pressing this aspect. It's out there, but it's a very, very small part of that. And what they really need to do is look into that and not look into the ACOs. So that is another provision, a major provision that the Affordable Care Act has that's not going to help us decrease health care costs. So with that in mind, I'd like you to visit my website, balancehealing.com. You'll find all these videos on it, and I have even more videos that are now going to go into the quality of care and what the Affordable Care Act does for that. But in the meantime, you can find lots of information on balancedhealing.com that will help you navigate our healthcare system and find the most cost-effective treatments to benefit your health. Thank you for watching this video, and I hope you return to see the other videos.